Introducing Dr. Scott Rossi, Chief Strategy Officer at Nexus Dental Systems, speaking about medical integration in dentistry today.
I was a junior in college when I interacted with a clinician from the University of Pennsylvania who strangely, at that time, navigated the world between medicine and dentistry. That moment changed me. It led me down a career path in oral medicine, a field that lives at the intersection of dentistry and medicine, but far too often feels like no man's land. And it planted the question that has shaped my career ever since. Why are we still treating the mouth as separate from the body? In today's healthcare system, we've divided the patient into silos. Doctors treat the body, dentists treat the mouth, optometrists treat the eyes, podiatrists treat the feet, pharmacists manage medications. But the science doesn't support that split. We know the mouth is a gateway to the rest of the body and a barometer of overall well-being. We know periodontal disease is linked to diabetes, cardiovascular disease, stroke, adverse pregnancy outcomes, Alzheimer's, even COVID. We know that patients who see a dentist regularly cost the healthcare system less over time. And yet, 60% of Americans with medical insurance don't have dental coverage. And even when they do, medical conditions that present in the oral and maxillofacial region, like obstructive sleep apnea, go unaddressed because we've created a billing firewall between two professions that should be collaborating. This isn't just bad care. It's bad economics, and it's inefficiency at scale. And it's leaving the most vulnerable patients behind. Imagine a world where dentists could bill medical insurance when treating medically necessary conditions. What if an oral cancer screening, a biopsy, a sleep apnea device, or salivary diagnostic tests could be reimbursed like any other medical service? That's the world we're building at Nexus Dental Systems. And the engine behind it is Nexus Bill. Nexus Bill is not just a billing tool, it's a bridge, a fully integrated platform from the ground up to allow dental providers to submit medical claims accurately, compliantly, and profitably. We're talking about automated medical necessity documentation, AI-enhanced pre-authorization workflows, real-time eligibility checks, medical claim optimization, and expert human coders when it matters. And more importantly, it's education-backed. We don't just give dentists the tools, we give them the education, training, and support that they need to use them with confidence. Because the future of healthcare won't be about more technology, it will be about more intelligent connection between systems, providers, and patients. At Nexus, we see a world where dental offices become early detection hubs for chronic disease, oral health data informs systemic care, and reimbursement aligns with prevention, not just procedures. And that's not just wishful thinking. It's already happening because we're already working with practices, DSOs, and payers across the country who see the writing on the wall. I've spent my career in dental education, academic leadership, the practice of oral medicine, and a focus on healthcare strategy. I have seen the brilliance of our clinicians and the brokenness of our systems. But I believe we're at a tipping point. The mouth is not separate from the body, and billing should not separate care from access. We can no longer afford to treat the mouth as a medical afterthought. It's time to integrate. It's time to innovate. It's time to transform healthcare from the inside out. Because when we connect what's been divided, when we align the incentives with evidence, When we tear down the silos between medicine and dentistry, we don't just change billing, we change healthcare, and we change lives. The future is Nexus, and that future is now. Thank you.